the cloud. Welcome everyone to the latest Facebook discussion that the Lexington-Fayette County Health Department is having about COVID-19 and its effect on race, especially African Americans here in Lexington. We want to take a few minutes before we get started so to allow more viewers to join us. So please send a text to your friends, share this post, tag people in this, call somebody, pick up the phone and tell them to tune in and watch this, because there's going to be such great information. We have a very, very esteemed panel of guests joining us to talk about it. And one of the things that's going to come up later in this is some opportunities for testing that's going to really, really help people in Lexington. Whatever you can do to help spread the word on this is appreciated. So a few notes before we get started. It's been almost 3 months, and it's hard to believe that it's been 3 months since Lexington had its first confirmed case of COVID-19. It happened March 7th was the first case in Lexington. As of May 26th, we have 634 confirmed cases, and 33% of those, exactly 1/3 of those, were African Americans. Now, if you look at Lexington's demographics, about 15% of the population is African American. So this is truly an issue, because it's disproportionately affecting African Americans, not just in Lexington, but it's in many cities across the US. Now, we had this discussion, we started these discussions back in April to talk about why this is happening. And we talked about public accountability. That was a big piece of this. As a health department and as the public health agency for Lexington, we didn't want to just throw out ideas and talk about it. We wanted to put things into action. And today we want to update you on some of the steps the health department and others have done to help with this issue. We're also going to be announcing some exciting new information that we hope will help many, many people. Now, again, I say this every time, we are not going to solve the problem today. That's not what this Facebook discussion is about. But what we are doing is having honest talk about COVID-19 and race. It is real, it is raw, it is honest. And it's with the hope of improving the outreach of important public health information. We said at the beginning, this isn't the last time we're going to have this discussion. We're going to keep doing these. And we're hoping that it leads to more discussions that go beyond COVID-19. I know one of our guests has already started that process, because this issue, the impact of public health and health in general on African Americans, is not a new thing that COVID-19 has created. COVID-19 is putting a much needed spotlight on it. And that's why our guests are here to talk about it today. I'm excited about this panel. There are, let me just start with it. We're joined by Dr. Tukea Talbert, the Executive Director of Diversity and Inclusion at UK Healthcare. We have Pastor Nathl Moore of First African Baptist Church in Lexington. Andrea James, Community Response Strategist for the City of Lexington. Vivian Lasley-Bibbs, Director and Epidemiologist in the Office of Health Equity for the Kentucky Department for Public Health, and also a member of the Health Equity Network of Lexington-Fayette County. Kacy Allen-Bryant, Board of Health Chair and Nurse, and Devine Carama, Community Activist and Hip Hop Artist. Those are just a piece of their titles. We would fill up the entire hour reading off all the titles that this illustrious group has, but I can't thank you enough for being here and joining us and being a part of it. I want to start things off today talking with Kacy Allen-Bryant, because she is representing the health department and the public health aspect of this. Kacy, let's talk a little bit about what the latest is with COVID-19 in Lexington. As I said earlier, we have 634 confirmed cases, 33% African Americans. Is there anything that you would like to add for our panelists to know about before we get going? Still on mute. There we go.
It takes me a second. Yes, thank you for inviting me here today, Kevin. And, we have a lot of exciting updates at the health department that I would love to share. I don't know if you want me to share those right now. But as you said, our numbers for our Fayette County Health Department, we are African American, our brown community, Black and brown community are still proportionately represented in the numbers. And so we have taken many steps to help reduce that disparity that we have there. We are still encouraging, and I'll talk about this a little bit later, we're still encouraging, social distancing, wearing masks, all of the preventive measures as our Kentucky economy has opened back up so that we do not see an increased surge in our numbers.
That's a very important point. Thank you for mentioning it, Kacy. If anybody has any questions about how to make a mask, I know a lot of things that have come up in previous discussions were, how do I get one? Right now, you don't have to spend any money. If you've got any sort of cloth material at home, a handkerchief, a bandana, a t-shirt, if you have that and a rubber band, go to the health department's Facebook page or the Kentucky COVID page, and there's guides to show you how to make those. I want to turn things over to our panelists now. Dr. Talbert, let's start with you. This is going to be the same question to everyone here. I'll give you 60 seconds or so to talk about why is this important? Why is this topic so important to you? Oh, we're going to stop. You are still on mute. One of the
there we go. Unmute.
One of the learning curves of the Zoom world.
Yes. So thank you, Kevin, and again, very honored to be here with the other panelists and guests that you have. So why is this important to me? And just as you had mentioned about Kacy, I am trained as a registered nurse. I'm a member of a healthcare team, and it has been my professional commitment and personal commitment to health, well-being, wellness of patients from all backgrounds. So with healthcare, and especially when I started in nursing just a few years ago, healthcare has never been about race or an ethnic boundary in my mind. Now, the reality of that, and I think COVID has helped magnify that, is quite different today. But it's important to me because I am a registered nurse and I'm part of a healthcare team, and it's my work, it's my business. But also recently, there was a test or some survey results that the NAACP had conducted in tandem with some individuals and entities with the Yale School of Medicine. And from those test results, it revealed three critical things, I believe, and it states why this is important to communities of color and African Americans is one, that they feel that 80% of the people wanted to hold off on ending the shutdown, the economy opening back up, to first assure safety. That's 80% of the people. But then also, this same study revealed that people described COVID in words such as dangerous, deadly, death, scary. So if you want to know why this is important to me, secondly, it's important to me because it's important to the community that I am a part of. So I would be remiss to say otherwise. And also from that same study, many people felt that physicians and nurses are trusted messengers. And I think this is very important to leverage during this pandemic, because I and other colleagues need to be out there educating people and helping them through this pandemic for safety and maintaining health.
Thank you for that. One thing I like what you said there at the end is using the messaging of nurses and physicians and those medical professionals. Kacy, I think that you've been on some of those calls. I know Pastor Moore, I know you have as well, that I know the pastoral group we've been working with has suggested that is using the medical community and making sure that we reach out. I believe it was Dr. Gerald Smith who actually was really saying that we work with members of the medical community who are African American and using them as a much larger outreach. So yeah, great point, Dr. Talbert, and something that we can continue to talk about. Andrea, let's say the same question for you. Why is this so important for you?
It's so important to me because many of the issues that I've worked on in my career have to do with education, getting the word out, and then figuring out what are those barriers to application. So if we have information, what's the reality of the information and the situation, and what's the perception of it, and how do we close those gaps, those information gaps, so that people find their own truth within whatever the messaging is. So my thought is with COVID, the same as with the opioid situation, the same as with alcoholism, with substance use in general, is the answers are out there to help us to have a better response to those things. What happens is that somehow within that messaging, something happens and we translate it in a certain way that's relative to our experience or our generation or our family tradition or something. Fox News or CNN or whatever it is. We take that information, we filter it through something else, and when it comes out, it can be received as something different than the original intent. So I'm interested in figuring out, how do we take the messaging we're getting that is supposed to have us in the best form of health? So public health officials are putting out the best information they know. And how do we make sure that that information removes, that all barriers are removed from that information, that there are no filters that put us at greater harm? So that's for all the work that I do, whether it's helping communities to develop, helping a candidate to get elected, or working on opioids, or working on COVID. So I'm interested in that translation and that filtering of information.
And it's interesting because we see that Kentucky is on the national spotlight in our response. I think we are leading the country in our response to COVID-19. But on a local level, as great as Lexington's been doing, we know that there's still much, much more to be done. When you have 33% of the cases affecting one racial group, and that is only 15% of the population, there's truly more messaging and improved messaging that needs to be done. So thank you for bringing that up, and then your work in helping continue to improve that messaging. Nathl Moore, let's same question to you. Why is this so important for you?
Well, first of all, Kevin, let me say thank you so much for all the work that you've been doing, Laura Hatfield and others from the health department, even fostering these conversations from the initial jump, because normally after the apex of a crisis, if you will, kind of surpasses, we all end up most of the time anchoring back to our own little silos. And so thank you for furthering the conversation. For me, I'm very interested in this topic, or even being part of this discussion again with this panel, this esteemed panel that I'm very humbled to be with today. It's important to me as a pastor, as a shepherd. One of my first responsibilities as a shepherd, how I perceive it to some degree, is protection of my flock. And so that's protection, not just from a spiritual perspective, but also in my mindset, even from a physical perspective. So being part of the African-American community, and looking at and the disparity that was there, that already grabbed my heart. And also because of the fact that I serve a predominantly senior dominated congregation, and they're in that at-risk category, I was even doubly in tune to what was going on out of my care and concern for them. And so that's why I want to continue to stay involved so that we can do what we can to protect not only our seniors, but the community as abroad. From a shepherd's perspective, it's not just shepherdship of my congregation, but I feel an obligation to my broader community, in particular within the Western area that our church is located in. So we've been trying to be intentional on providing ministry to the broader community. And so this is in one of those areas. And so whatever we can do to help foster, Andrea just mentioned messaging. I think one of the things that helped early on was the fact that you all, the health department connected with the pastoral fellowship, or the pastoral fellowship connected with you all, and together we were able to collaborate on what that messaging would sound like coming to our community. So those kind of collaborations are very important for messaging, but also very important into making various connections and inroads into the community. So as a church leader, as a community leader, I have a vested interest in doing whatever I can to foster the health of the community that I'm a part of. So again, I feel, the church is a very vital part of that. And again, we want to do all that we can to help contribute in those areas. And so these kind of collaborations are so important. I think also, as Dr. Smith mentioned early on, with getting the medical department with Dr. Talbert and UK involved, again, that added another level of credibility. So when you're dealing with a community that's already has some distrust issues, whatever you can do to alleviate those levels of distrust, it goes a long ways to helping to improve conditions in that community. So that's one of those spiel for now.
Thank you very much for that. One thing I want to follow up on, you mentioned at the very beginning, is that in a crisis, we often sometimes retreat back to our silos. Dr. Talbert is not going to let that happen. After our last discussion, she immediately was talking about how can we use this to springboard into these bigger discussions. And Dr. Talbert, we'd love for you to talk about that a little bit later, but I want to go to Vivian now and give her the opportunity to about why this is so important for you. And I also have another question that you can work in as well. Since you do represent the Health Equity Network of Lexington, can you explain to our viewers too a little bit about health equity and how health equity is different than equality?
Right. So my office, as I said before, talks about equity, and people always kind of talk about health equity and health disparities meaning the same thing, and they're very different. Health disparities is where one group is disadvantaged over another due to some socioeconomic, usually expressed in the form of a rate or a number. Health equity is how we close that disparity gap by addressing some of those social injustices, some of those inequities such as housing and education and access to care and et cetera, to kind of look at some of those underlying risk markers, I call them, that are impacting long-term health outcomes. So my colleagues across the country, we're so excited now. If you want to say our excitement, we talk about health equity all the time, and we take this message around our state, and we go to national meetings and we talk about equity as it relates to African American communities, Black and Brown communities, and what we need to be doing to close the disparity gap. But COVID came so hard and so fast, it ripped that Band-Aid off quickly and exposed a lot of the things that we had been talking about. And now people have been having that aha moment, something that we've known all along, some of those upstream, what we call upstream factors that are impacting right now where we are in this pandemic. So it's important to me to like continue to have the community conversations, for people to finally talk about some of those things that we know as communities of color are barriers and challenges and things that we need to be talking about in order to close those disparity gaps as it relates to those inequities that impact people of color. So I'm excited because I'm actually happy to see that Lexington is taking that big giant step to me to have a broader conversation about all of those things that are impacting our response to COVID, whether it be in messaging, whether it be in the healthcare access piece that's being provided, and kudos to Devine Carama for offering whatever he can do to bridge that gap for communities. I'm just excited about being a part of this group today to have this discussion, because I feel like I have it sometimes in isolation where I am, and people are like, yeah, we got disparities. Yes, that's wonderful. I love your equity. Yeah, I get that. But, what do we do? We've been talking about social determinants of health since 2008, 2007, about those, inequities in housing and education and income, and we're still talking about them now. So hopefully COVID can have us talking about some of those upstream things, some of those systems of power and policy and wealth and historical injustices that have over generations and over time still are impacting health and our access to healthcare and our trust of the healthcare system. So, okay, I'll get off my soapbox now. I know I have only a short period of time and there's 6 other people, so.
Well, we appreciate you sharing those thoughts. One thing that you mentioned about ripping that Band-Aid off in these discussions is that so many people are uncomfortable with that too. That I know that not on the health, when the health department has shared this in future discussions, the Facebook comments have been very supportive. But I know with our very first one, at least one media outlet aired the stream live, and people were. People are uncomfortable talking about race. Some people are uncomfortable talking about race. And I remember more than one person saying, oh, why are you playing the race cards? How can you not, this exists. This is a problem. The numbers, it's just the numbers alone show that this is a problem. So thank you for bringing that up and for continuing that conversation. Using the numbers makes me, I forgot to mention this at the top, when you hear me talking about numbers or percentages, you hear us talking about it, do not for a minute forget that we recognize those are real people, that every number, every percentage, there is a human behind that, there is a family behind that, there is someone who is loved by someone, and that is important to remember. No matter who we are talking about or what the number, where they're coming from, these are real people. So please don't think we're getting lost in those numbers. The 33% we're talking about, those are human lives that are being affected by this. Devine Carama, thank you. You were on our very first panel, so welcome back. Why is, make sure I'll keep talking while you unmute yourself. Why is this important for you, particularly for someone who has such involvement with the youth of Lexington and Central Kentucky? Why is this outreach important for you in this discussion?
Sure. First and foremost, I'm a Black man. My parents are Black, my beautiful Black wife, my beautiful Black children. So, anything that is focused on serving and preserving the life of who I am and who my family is going to be important to me first and foremost. And then, as you said, just being somebody that works with young people and youth for a living, I'm really concerned about the messaging piece when it comes to things like this in regards to the youth. Working with young people, we're kind of in this kind of timeline generation right now where, they encapsulate things in moments, whatever is in their timeline in the moment means a lot to them. But then as soon as the next trending topic comes, now they're passionate about something else. And the problem I'm seeing is the inability to connect a lot of these instances. So when Miss Vivian was talking about messaging and how COVID actually highlights issues within, a whole lot of issues, I don't think young people understand that. I don't think they're seeing things that way. I think everything is a meme, a trending topic, the next TikTok dance. But how do we make this serious to young people, and how do we control the messaging to where they can start connecting the dots when things like this happen so that they can focus, because we're not going to be here forever. They're next up. And we want to leave them the information to be able to connect those dots and understand that this is bigger than just COVID-19. So I think that we got to start reaching young people where they are, which is why this is so important to me. And I love what you're doing. So some of the avenues in which we talk about this kind of stuff, we got to adjust that if we want to reach young people. It may have to be in TikTok. It may have to be on a Facebook live stream or Instagram, or as a hip hop artist, it may be through my lyrics. But we got to stop talking down to the young people, and we got to start figuring out how we can reach them where they are. So I'm all in, and thank you for facilitating this, and I'm blessed to be here with everybody else.
As someone who has heard some of Devine's lyrics, I can definitely say that the outreach there is phenomenal, because you are a poet, a very talented wordsmith, and anything that you can do to continue reaching, because it's not just young people hearing that. there's some older fans as well, but keep that up, because that is fantastic, and thank you for that insight into how to do on that outreach. Kacy, why is this important to you as a nurse, as a mom, as the board chair?
Right. Well, I could go on and on about why it's some obvious reasons why it's important to me. Just like Devine said, this is my culture that we're talking about. I am a mother. I want to protect my children. I want to protect my loved ones. I want to protect my elderly loved ones in particular. But as the board chair, I did want to say that, Lexington-Fayette County Health Department, we are here to protect everyone. And so when we see that there are some obvious disparities, we know that there are things that are not equitable between groups. And so we definitely, when we see these numbers, we jump on this because it is important for us. We're helping Lexington be well. That's not Lexington, this community, Lexington, that community. It's Lexington, everybody's community. And so addressing this huge disparity that we have with African Americans in particular, this is one of our goals is providing equitable care.
Yeah, and thank you for mentioning that, Kacy. Our values at the health department, spell out the word CARES, and it's caring, accountability, respect, equity, and service. And I think you hopefully are seeing all of that put into play here. Speaking of equity and service and accountability, I think all come into this. Kacy, do you want to start to lead into that discussion on what the health department has done since we had this first conversation in believe it was in April is when we had our first one.
Yes, I believe it was in April, and Devine was able to join us as well as others. We have had multiple discussions with multiple groups because it does involve different community partners. We've had discussions with our mental health community. We've had multiple discussions with our African American pastoral groups and the mayor's office and what we can do to address some of these issues. We have also done things like promote how do you wear a mask? If you can't buy a mask, how do you make a mask at home? I mean, we've even put out videos for it. We have
started one. You did one.
Yes, actually, I did one. We have done other things like, other more public awareness, like their interviews, and like Kevin said, the one when I started where I did the face mask. But one of the biggest strategies that we've done is we figured out that transportation is a huge issue for many communities, but again, we're talking specifically about our African American community. And so one of the initiatives we started was doing at-home testing for people who cannot go through the Kroger drive-through, cannot go to the Walgreens drive-through. We have had it set up so that you can call the health department, make an appointment with us, and we can come to your home, of course, being wary of social distancing and taking all those precautions as usual, but coming to your home so that we can do the testing for you and with you. So that was a huge initiative that we started, and those were all ideas that came out from above all these many discussions that we've had with various community partners.
Right. One of the things with the at-home testing, and it was initially offered, we were working with the pastoral group with members like Nathl Moore, Keith Tyler, and many others to help do some of the at-home testing with the limited availability. From our very first discussion, our first two discussions, whenever at-home or whenever drive-through testing came up, all the panelists said, transportation is an issue. You have to have something in place for people who can't drive there. Unfortunately, the health department and the mayor's office had no control over the BCTC testing because that was being done by Kroger, and it's more of a state initiative, and they reached a wide audience, but we were able to work with the mayor's office, the pastoral group, and come up with some ideas and some ways to help. Also want to say, Kacy, when you mentioned it's not just the mayor's office, it's the mayor herself has been
yes. And she's, as a fellow nurse, as Dr. Talbert, we're very proud to have a fellow nurse in the mayor's office. Yes, right, thumbs up. She has always been a huge advocate of all of the measures that we've done at the health department. And of course, I'm going to specify health department initiatives from carrying the spray now down to our COVID initiatives. And so I would like to think that any mayor would be that, but I want to brag the fact that she's a nurse, that she really does understand the importance of our preventive measures that we do at the health department.
Kacy, do you want to be the one? Do you want to talk about our wider at-home testing, or do you want me to give the details on that? What do you?
You can give the details of those, Kevin.
So we, as the health department, are really excited to announce that we are expanding our outreach for the at-home self-collection. Now, it is important to remember that there's limited availability. We can only do a certain amount per day. We only have the staffing to do a certain amount per day, and we only have a certain amount of kits available per day. But these are for people who have transportation issues. So this is not for, I just don't feel like driving today. This is, I don't have a car, or I am sick and can't drive, or whatever transportation issue you have. You're sick and can't get on the bus to go because you can't do walk-ups at BCTC. If you fall in those categories, there are transportation issues, we are able to provide at-home self-collection. I'm reading here to make sure I get the times right, 8:30 to 4 p.m. Monday through Friday. All of this will be posted on our Facebook following this discussion, and we'll be putting the word out there. But you call our COVID hotline, 859-899-2222, to get information on how you can get connected, do a very simple screening to find out about the at-home testing. The reason we do the screening is just if we get more requests than available, we want to prioritize. And those priorities are based on if you're experiencing COVID-19 symptoms, if you are a known contact with a case or a symptomatic person, you're a healthcare worker, or you have underlying health conditions. So again, limited availability, but this is open to anyone in Lexington. You have to be in Lexington to be able to do this. You can't drive into Georgetown. Unfortunately, you have to live in Lexington. Andrea, did you have a question?
I have a comment. I wanted to say that I remember the conversations around when this was, we were trying to figure out how to answer that transportation call. And, you know, everybody was brainstorming. We met a couple of barriers with some ideas that folks had. And when the health department offered this as an option, it's kind of like, okay, great. I mean, we've all done this work where you offer an opportunity and you just put it out there because you hear the call from community. So the pastors talked about transportation and the health department responded. I was on a call when I got the notice or heard the report out that there had been a positive COVID test from one of these at-home services. And I'm not happy that anybody has COVID, but I was thrilled that this service was available because I think that person may have had some underlying health conditions or was immunocompromised or something, and they didn't have transportation. The thought that this person knew that they were positive and could get the care that they needed because of that, it warmed my heart. And it's the kind of stuff that when you do this kind of community work, it makes it all worthwhile. All these conversations are done to get results. And so I know this is not supposed to be a pat on the back health department conversation, but I do have to applaud you guys for that effort.
Well, thank you. And let me just expand that a little bit though on that, because it wasn't just the health department. It was the people on the first call and the second call and all the conversations that we've had who kept saying, you have to do something for the transportation issues. And also, I want to thank the pastoral group. And Nathl, I think you might have been one of the people who talked about the at-home testing, the self-collection, and I want to point this out. It is not the giant swab that they do at the medical offices. We are not asking non-medical professionals to take that 12-foot swab and to tickle their brain with it. It is not that at all. We've got a flyer that we're going to put available to show people it's a little easier. It's not all the way back into the nasal cavity. And there are step-by-step instructions with the kit to show you how to use that. But so I bring that up because that came up on the call with the pastors. It was people were afraid to say, they would say, I'm not qualified to do this because I'm not a nurse. I can't stick that nasal swab all the way back in there. So hearing that response that's how we improved our outreach, and we appreciate that. It's the accountability that we are asking for. We don't want to have these conversations in a vacuum and then just feel good that, we talked about it, the problem is solved. This does not mean, of course, that doing one thing and get as big as it is doesn't mean the problem is solved, but we thank everybody for pointing this out and working with us.
Kevin, if you don't mind, if I can jump in, I know this is, again, as Andrea says, not a pat on the back, but I do want to give a pat on the back to everybody involved with that because it gives tangible proof that collaborations work. And unless there was another, I'll give a self-disclaimer, unless there was another positive test case that came out of the at-home testing, that was a benefit of one of our members that came as a result of another one of my members, two of our members taking advantage of the at-home testing that said it's not like what you think it is and you need to go ahead and do this. And so that's why even as we do things and messaging goes out, it's important because we had some who were not doing it because, hey, I'm not taking that big long swab. That's not what I do. And so having these conversations goes a long ways. And so again, it works. And so I just wanted to again congratulate everybody on that. But again, just wanted to say those are the kind of collaborations that we need to do. And then I want to touch on what Brother Devine said earlier, even about messaging. Because when we came to the table, that might have been part of our short-sightedness as well. But that's why, again, having so many around having conversations is important because we were thinking about when we did that messaging or having those questions, we were thinking about the at-risk group. We were thinking about a senior laden population. We were thinking about how do we connect with those who may not have access to Facebook, who may not be doing certain things? So how do we get messaging that we can portray through our websites? Because some of our members don't do Facebook, but they'll go to our website, you know. So, or they'll get it from somebody else calling them and saying, "Hey, look, do this." And so again, we were turning that group. But like he mentioned earlier, how do we now shift messaging to target that younger demographic, because they need this information and other information, which is just as important. So again, how do we do that is again, I think is all part of those broader conversations. But yes, I just wanted to just say that it works. I mean, I have to give own testimony that yes, it works.
Well, thank you for sharing that. And it's for the person who passed the information along, we are very appreciative of that. There is no doubt that lives have been saved through some of the work that has been done through your group on that. And thank you for that. Dr. Talbert, I want to start with you. I'm going to start with you and Vivian on this because you're two of the newer panelists in these discussions. But what are some of the barriers that African Americans are facing for COVID-19? We've talked about transportation being an issue, but what do you want to talk even on a historical aspect? I know both of you have talked a little bit about some of the long-standing distrust issues. So the floor is yours on barriers, whether modern, historic, or even if you're able to, any future thoughts.
Right. So I think everybody's really hit on it, and Vivian did an outstanding job, and Andrea as well. All of you all are fabulous. So I'm really honored. I really am to be a part of this. But I think when we think about this conceptually, distrust is probably number one. Distrust, misinformation. When Andrea earlier talked about some of these filters, and when information starts at the beginning and by the time it reaches people is something totally different and colored in a different flavor that results in misinformation, which serves as a barrier, because I think it also gets in the way of people seeking healthcare, and also I think opportunity. And so if I wanted to unpack that a little more, I think all of those are predicated on historical failures in the healthcare system based on racial bias that has impacted people's ability to access equitable, that word that Vivian used earlier, equitable care. And if people feel that they have a history of that, past or present, they're not going to seek healthcare. And one of the things that I know I was reading with the World Health Organization, the WHO, the WHO, there's a professor, Whitehead, I think, that stated, ideally, everyone should have a fair opportunity to attain their full health potential. And so when you look at that, and that's where I see that in terms of some of the times when people have had poor or bad experiences or bad outcomes, these are things that create in today's world distrust, misinformation, and opportunity and barriers to seeking healthcare. And I think that this is real evident when you look at some of the hot spots in Louisiana being one example. And there was an article in the New York Times, and it was awful. But when you looked at the number of African Americans impacted in that state, it was very interesting to find that many of them were diagnosed with COVID-19 post-death. It wasn't pre-death. So what that meant is these individuals had gone and sought care, maybe were tested for flu, tested negative, so were sent back home. And sometimes it would make one wonder, I'm not labeling this, but you have to think about, did these people have a fair opportunity to attain a full health potential when they were sent back home from emergency departments and other facilities and weren't even tested for COVID, but posthumously, post-death, they were diagnosed with COVID-19. So, yes.
Let me throw in a number here for you, because I'm not sure if you're aware of this. In Lexington, of the 101 hospitalizations that have come from COVID-19, 42% of those have been African Americans. And so for you to mention that so many times it comes too late, that really makes that number stand out. Is there anything else you want to add on that, or any other thoughts before we talk
for
about
that particular statistic?
Yeah, on that, or about it being and the
And again,
The people about it late, because that really just that frightens me.
yeah, and it is frightening. It's very scary. I mean, and some of these individuals, I think, again, if we're going to be the trusted messengers in healthcare, when we have these individuals, because we already know that many of them will have comorbidities. So that is our opportunity, not only to make them better from if it's a COVID-19 diagnosis, but to look at all those other illnesses that individuals come in with, that you have a time for educating, follow-up, polypharmacy, I mean, medications. People come in on several things and oftentimes haven't even received recent counseling on why they're on said drugs, and if it's even still necessary, and drug interactions. And so I think that the hospitalization, and it's hard to look at the ones in Lexington to understand if they're hospitalized because of their being very ill, or if they were hospitalized late, with the 42%. But it is a high percentage that's hospitalized, and it's almost equal to that of Caucasians. But of course, Caucasians make up a larger percentage of the population share. So it is an interesting number, and it's either that they're sicker or they're waiting longer to come in and they're having to be hospitalized, being diagnosed later.
And I'm glad you mentioned that, Dr. Talbert, because when I have conversations with other directors of minority health and health equity offices across the country, we talk about just that. One instance in particular, I can't remember the young lady who has since passed, who was denied twice, went to the hospital twice, and was told she couldn't be tested for COVID. She didn't have COVID. She went home and passed away. So there are anecdotal instances that we're hearing about where people are doing just that. And I think that's where I'm not going to point the finger at any healthcare system, but our biases and the implicit or unconscious, whichever one you want to use, those biases come into play in healthcare. And it would be interesting to know whether, Evan, those hospitalizations, here's my epidemiologist hat coming on, how we slice and dice those, looking at those comorbidities. Is that what drove them to the hospital, and that's why they were admitted, or was it actually COVID? Because you got to remember, and a conversation I was on that really disheartened me was putting the blame game on Black and brown folks for having that disproportionate number of hospital admits and deaths because of obesity, hypertension, diabetes, and asthma, and as if it were something inherently wrong with our population, with Black and brown folks, as to why we were having these disparate numbers. So, there's some additional conversations we need to have as to why folks are not going to the healthcare system in a timely fashion. Is it because of the mistrust? And we know it is. And is it because of some of those biases that they face? Yes, it is. And how do we have that conversation in our medical professionals that are coming through? Because when I came to PA school, as another hat long ago that I wore, I didn't get any unconscious implicit bias, cultural competency training. I didn't get that. Kacy, I was there when you were a nursing student. I'm not going to tell you how old I am, Kacy. That's okay. But
I know this, Vivian.
We didn't get that. So there's some things that we need to inherently look at as a system on how we're training our healthcare professionals. And I think this COVID-19 pandemic has revealed that as well. What's that training piece looking like for the healthcare providers? And how do we make sure that they're given the right message to Black and brown communities? And I really want to touch back on something, Kevin, if I can, something that Pastor Moore and Devine Carama said about messaging and framing and how we talk about communicating to different populations. I just presented a training this morning at the health department on how equity is not one size fits all. And what you do for one population or community doesn't necessarily fit the other population. So I'm glad you mentioned that youth are totally different. I've got two twin daughters, 20 years old. They communicate totally different in a whole different platform than mom and dad. And you're right, it's 2 minutes or less is their attention span and they're on to the next thing. So, I'm glad that we're having that, recognizing that each population and each demographic group in each community is totally different. And the messaging that goes out to them and how that's filtered through, as Andrea said, I like that word, how we filter that through and how that comes out on the other side can be totally different. And I think if I can bring something else up, I don't know if y'all have talked about it on prior webinars, is how the message of social distancing and what that meant to communities of color. Social distancing to us meant everybody else, not family, and not, you know, it meant something totally different to us. So, and it was very hard for us to grasp that concept from a cultural standpoint. So I just think we need to recognize that all populations are different. And I applaud the fact that we recognize that, and the messaging and communication piece that goes out to them has to be totally different.
Yeah, and that's something that Kacy has talked about, were some of the cultural differences that have come up. Kacy, do you want to just real quickly talk, kind of recap some of the things you've talked about with those cultural differences that you mentioned?
Well, sure. I mean, and that was from our first conversation that Devine was able to participate with us, is that you're right. For us, when you say you cannot be around others, that does not mean family. That means that we can still go visiting. That means that we can still drop our kids off, because we're very much a village takes a village to raise a child type of culture. And so, you know, we still want to get our hair done. I mean, you know, there's all these different parts of us that are still important, but to kind of break that down and say, hey, this is where we have to stop. We know we love our family. Let's try to think of something else to do. At the time that we had this first conversation, it was Easter. For our church community, my family community, it was devastating that we could not get together. But we had to stress that it's important to physically distance. Our commissioner, Dr. Humbaugh, that's the term he likes to use a lot, physical distancing. And it's not that you have to be socially distanced. We can Zoom, we can call each other. There's other mechanisms that we can to stay in touch, which is so important in our culture. But we have to maintain that physical distancing, and it means not mixing households as much as possible. And I hope I recapped enough. But that was a very long conversation that we had during our first call to hone that message in, because for me, it's been difficult. And I have the medical brain, but my culture's pulling me another way. I want to say something else about messaging too, and this is just a quick, before I forget this, is that, you know, one of the things we talked about in our first call were some historical factors, like the Tuskegee experiment and the Henrietta Lacks story where they were using her cells. And so I want to say to people, just as a quick aside, we are doing this at-home testing. It is to test you for COVID. We are not experimenting on people, and we're not there for an alternative reason. We're not there to report you to the POPO or anything like that. I mean, we are there only for COVID testing. And so I would hope that any of those kind of historical factors that are kind of in the back of our minds, and the fear of governmental, or which we're a quasi-governmental agency, anything related to the government is something to be feared. That's not why we're there. We are there simply to provide an alternative testing mechanism to get people tested for COVID.
Thank you, Kacy. For those of you watching, if you've not read the book, The Secret Life of Henrietta Lacks, you absolutely use your time on this shutdown to check it out from the library, to read that book. It is one of the most fascinating, best things I've ever read in my life. Yeah, it's even hard to put into words everything that happened with that, but it's come up every discussion, and on some of the others I participated in. Read that book. It is phenomenal. Andrea, I'm going to put you on the spot just a little bit. One of the conversations we had in setting all this up before, you talked a little bit about privilege, because you went out and you saw people early on, before the mask or the recommendation from the governor. It might have been early, it might have been right after that. And that talking about the people you saw not wearing that mask, and who was and who wasn't. Can you talk a little bit about that for our viewers? Because I think that's so important to recognize some of those issues.
Yeah, well, first I'll say we had a personal experience with a mask. We live in Fayette County, but we're close to the Clark County line. And we went down to Clark County. This was before the shutdown, really. This is when I was hearing some things from government perspective. it just wasn't really sure. We weren't really sure what was going on. But I wanted to protect me and my husband. So I ordered us masks from a friend made masks. And I thought, well, I got them in just a couple of days. And we wore our masks down to this country rural store. It's a farm store. I'm a little bit of a farmer. We go inside, we head inside of the store. And me and my husband are one of the only few people wearing masks, and we are the only people of color in the entire store. There may have been one other person. He was approached by the manager and asked if he was there to buy gardening stuff. Like she actually came up to him and asked if he was there to purchase. It was awkward. I felt bad for him. Because I don't know what that's like to be a Black man in an all-white situation, and also to be wanting to protect our health for ourselves and for our children and for our community. But we stayed at the store because we were determined to get the stuff we needed to do our farming. Came home and reported it to corporate because there was some correction that needed to happen there that I wasn't prepared to confront at that time. But what it made me realize, I started watching who was wearing masks and who wasn't. And even within my own friend circle, my white friends were less likely to be wearing masks. My white friends were still gathering, play cornhole and stuff like that. Whereas the Black community, I felt like my Black friends, my Black family, were being a little bit more cautious. As I started seeing the recommendation from the governor, and you and I talked about this, Kevin, I talked about it with Laura, I started hearing kind of what we all heard from kind of mass media and local media, that people were saying they have a right to not have to wear a mask. They've got freedoms to do so. And I had a conversation with Kevin and Laura by email about what a privilege that must be. To know that you have a healthcare system, that you are health insured, that you've got physicians that will take care of you and your family as if they were you were their own family, and do the best that they can when you show up to get care. I don't know that I feel 100% confident in that as a Black person in Kentucky, in this nation, in this world. So I talked a lot about privilege of the privilege that people have to not wear masks, or the privilege to still gather and to take that risk and to kind of not be judged by that. And I even jokingly said to my husband the other day, but not really joking, is if Black men didn't wear a mask, Black men would be the new mortal enemy in a new way. If they just decided to not do it, it'd be worse than sagging pants or something. You know, it just, people have judgment. They find those judgment opportunities every time they can. And we don't, as Black people, we don't have the privilege to say, never mind, we're not going to do it. Because it comes down in harsher ways. I don't know. What do y'all think? Do y'all feel the same way?
I just want to add to that. I talk about privilege when I talk about inequities, and how privilege, historically, how privilege of the dominant, the majority population had the things that's afforded them. And you so eloquently said the things that it hasn't afforded us to be able to do. I still see it myself living in Lexington, and I live in a zip code, what we call high risk in Lexington, or 40505 on the north side of town. And you can definitely see a difference in when I travel to some other parts of the city versus when I travel to my area of the city. It's total different response to COVID. And I'm glad, someone is saying that word, and they're telling us in my world, in the equity world, to stop using that word of privilege and use the word advantage. Well, I still want to use the word privilege because I think that really speaks to what is happening, and I'm going to still use privilege. So, but I think as that word is used more, and as that conversation happens more, Andrea, I think people are recognizing what that means contextually, And I'm hoping after this, at least our governor, I think, recognizes what privilege has afforded some versus others, even in his messaging. And I love that Kentucky has been very proactive, but some of the things that, you know, that he says as recognizing all of us don't have that privilege to eat out at restaurants 3 times a week, to patronize our restaurants, to work from home, to do, you know, there's just some things that he packages and says with all good intention, doesn't realize that everybody, right, is not able to do those things. And how that comes across to us in his messaging sometimes, like you said, comes out on the other side with that head tilt kind of going, okay, we can't do that. And so that sparks conversation with folks that I have with my neighbors as far as testing. Well, I've got to go to work anyway. I don't have the luxury of staying home. So testing, why do I need to get tested? My result will be the same. I've got to provide for my family. I've got to go to work. So, and it goes on and on and on. So, you know, I don't know how anybody else feels.
I've even heard some stories of people saying, I'm not going to get tested because it will put other people at a risk of being confined in their own families because they're worried about the economic impact or their jobs or whatever could happen if they are on that list, on that contact tracing list.
And to me, if I could squeeze in, Kevin.
Absolutely.
If to me, what Andrea, Miss Vivian, and all of you all are talking about is there's bigger issues, you know, and it's how do you connect those? You know, being a hip hop artist in spaces like this, I feel like I'm always having to explain the content in hip hop music, right? Or the culture of hip hop music. And one thing I tell people is hip hop represents for the voiceless. It's for people who don't have a voice. It's for brown and black people from the inner city. That's where it originated from. So if you don't like the content, then change the conditions. And that's kind of what I'm hearing and what we are talking about. All of these outlining things that are bigger than just COVID-19. You know, even when you look at, when I talk to a lot of young people, and this is young people speaking, you know, young people of color have this innate need to be around each other. And part of that is because we are such a small minority. We are marginalized and oppressed. So a lot of times the only way they feel value and worth is constantly being around their friends and being around each other. A lot of people talk about cookouts and in the Black church. That need to be around each other, there's healing in that, there's survival in that. But there's also oppression and things outside of that that leads to that need of being around each other. When you look at the living conditions, we might only make up 15% of population, but what's the percentage of brown and black people in Lexington that might be living in poverty or check to check, which leads them to live in an apartment complex or in situations where we are in close proximity. So to me, it is about connecting those dots. Even with a couple of young people I was texting yesterday, they're really upset about, you know, the George Lewis death, right? But it took 2 or 3 deaths in the last couple months for it to start connecting to them, like the Breonna Taylor situation, Ahmaud Arbery, and now this. So now young people are saying, wait, this just isn't a RIP t-shirt. This just isn't the hot button topic on Instagram. Like, I feel like my people is at war, like they're attacking my people. And now they're starting to ask questions. Well, Mr. Devine, why do you think this is happening? So it's about the messaging and connecting those dots, at least from the perspective of young people. And it shouldn't take mass death in order for those dots to be connected. And I think these conversations need to be framed in the bigger perspective of how we got here. Why is 33%, you know, of the cases African Americans when we only make up 15%? And yes, it's disparity within the healthcare system. I do believe that, but there's a whole lot of other issues that I think we got to take advantage of this opportunity. And I hate to say it like that, but to start having those conversations. And we got to be able to connect those dots to young people, because they're going to be the messengers of the future, and they're going to be the activists of the future. And we got to start using this as leverage to start pressing on some of these other issues. Or, you know, it may be COVID-19 now, but something else can happen 6 months from now. And brown and black people are going to be in the same condition and having these same conversations unless we start trying to make change, you know, on a higher level.
And I think, thank you for that, Devine. I think one of the things, you know, Vivian earlier, she used the word exciting in talking about this. And I know we struggle with it at the health department too, because we get excited about some of the things that we have the opportunity to do in this pandemic. And when we're talking about something that's so serious and frightening, to the general public, it may sound odd to be excited about it, but like you said, when you're preaching to the choir so often, and it's the people who hear your same message over and over. But now to be able to take it and expand it, that I totally get it. Where you're saying that is exciting, and I think it came up on one of the previous chats we had. It would be a failure of the system, both public health and I think in government, if we did not use this as a springboard for that bigger conversation. And you're exactly right, Devine. It's getting the young people, it's getting the middle-aged people, it's getting the older population. It's because we all have to talk about it, because it's not just affecting one age range. Obviously, the older population is more at risk, but the young people have to understand how to take it seriously as well. So thank you for that. I know we've been about an hour now, so I'm going to go ahead and start wrapping things up and give everybody a chance to leave with one message. But before I do that, I want to say one thing, and if you want to address this as well, you're welcome to in your wrap-ups. The governor likes to say we're all in this together, and we've talked about that, that's a great message, and we truly are all in this together, but the all is different, because the outreach and the response for all is it's unique to everyone. And I appreciate what each of you have brought to that, and to be able to educate our viewers on that. And for my end, if they don't take away anything else, I hope they take away about whether it's advantage, whether it's privilege, whether it is whatever word you want to use, that we all have different reactions to this, and it's not the same for everyone, but it's why we're having these discussions, is try to bridge some of those gaps. You all are, I say this with sincerity, you're saving lives by taking part in this today. Devine, you were the last to talk, but I'm going to turn it right back to you. What's your message in about 60 seconds of what you want to leave people with and moving forward with these discussions? Still got you on mute. It is the only time that we've heard.
I said I'll keep it a buck. I didn't know if the last time I spoke was going to be my last time, so I pretty much got everything off. But it was one thing I wanted to say that Pastor Moore and Andrea touched on that just stood out to me when they were talking about, I think it was the queen that essentially got her life saved by the home testing opportunity, is that they said it was like the second, third, or fourth attempt to her, right? Like one person said something, the other person said, yo, it's not as bad as you think. And it was that layered attempt. And to me, when I think about young people, that's what we need. Because whether it's a new song, the first time somebody's like, yo, you got to check this new song out, they're like, yeah, whatever. But when that second or third person says it, it makes them more apt to be like, all right, I got to try this, or maybe I need to watch this on Netflix. So it's that wraparound messaging to where, with young people, it almost becomes trendy. It becomes popular. So they're hearing it from so many avenues. They're hearing it in the music. They're hearing it from their parents, their friends, that it pushes them to go on and say, you know what, maybe I need to throw this mask on. It might not be fashionable, but I need to throw this mask on. Or you know what, even though the, young people supposedly aren't in the high risk population, we need to take this more serious. You know what I'm saying? So I think it is that messaging from all different angles, that second, third, and fourth call. It might not be the first one, but if we can just, stay consistent with it, with all populations, but definitely our young people, it might be that third or fourth nudge that gets them to do something that could save somebody's life. So.
All right, thank you, Devine. And I had faith that you would have more to say. So never sell yourself short. You've always got something more to add. Thank you for that. We really appreciate it. Kacy, what about you? What do you want to leave people with?
Well, I'm going to take it down to the basics here. Social distancing, physical distancing, whatever you want to say, and wearing those masks. Those two strategies together, this is how we're going to beat this pandemic. So just remember that. And of course, hand washing, yes. But yes, of course, hand washing, but wearing those masks and social distance, I cannot stress enough that of those two measures, when you are going out, if you have to go out, and, you know, of course, with the hand hygiene and making sure you don't touch your face and all of those as well.
All right. Thank you, Kacy. Andrea, what do you want to leave people with in this particular discussion? Again, not our last discussion, but what do you want? What's your message?
My message is, even if you don't feel like it's your responsibility to take care of other people, just take care of yourself. Make sure that you are doing everything that Kacy mentioned with face protection, hand washing, but just as you're doing anything, whether it's in your own home, if it's out on a walking trail, if it's if you decided to go grocery shopping or go to one of the restaurants that have opened up, think about what you need to do to protect yourself in the midst of all that. And if we each do that, we'll cut down on any transmissions that are out there.
Right. Thank you for that. Nathl Moore, what's your message wrapping up to our viewers?
Once again, thank you for allowing me to participate in this conversation today. It's been awesome with this esteemed group that we're with today. And I guess since I'm from the faith community, I guess that's my parting word: keep the faith. We're all aware of what's going on. Many of you have been dealing with these topics for over the years. But one of the things that can be that we can get lost in what may appear to be the hopelessness of the situation. And even though we minister and do work within the social context that we're in, and we're dealing with some of those dynamics from a social context, national and et cetera, that can cause more faithlessness. But I just encourage us to keep the faith. We are making a difference, and we don't know exactly the extent to the difference, but I just believe that as we continue to push forward, we are making a difference. So hang in there, and let's keep the faith.
Thank you very much for that. Vivian, your final message, but also have a request of you. If you can let people know, if they want to get more involved with the Health Equity Network of Lexington-Fayette County, you could share how they could find out more about that important organization.
So my closing remarks, then I'll talk about the Health Equity Network. For closing, I just want us to remember to have those conversations, and that's how we hold each other accountable. I continue to have conversations with my family, with my extended family, through Zoom, through calls, through my colleagues at work. We still have that conversation about what Devine so eloquently said, what COVID has revealed. So we put it not just in the context of COVID-19, but what has been historically happening all along. And now that the governor has put that out publicly, that it's being recognized and that he recognizes it, let's hold those folks that have that are in systems of power, or that are in some of those networks, hold them accountable. All right, we know that, we've talked about it. Let's put some meat to that. Let's start talking about how to really address some of these issues. And I feel like I can't tell other people to get tested if I haven't myself. So if you're in a situation where you need to be tested, get tested. It's not that bad. I tell people I've had it myself. In whatever method you choose as for your testing, just get tested and continue to, like Kacy said, wear the mask, and not just for yourself, but for others. Because I don't want to expose anyone to anything, and I would feel terrible if my lack of concern for my fellow man predispose someone else to something that could potentially do them harm. So as far as the Health Equity Network, we meet at the Lexington-Fayette County Health Department, and Tara Mason and myself, who works at the Health Department along with Mr. Peterson. Is he still there, by the way, Kevin? I haven't talked to him since COVID. So we meet usually every other month in the evenings from 4 to 5 at the Fayette County Health Department. Please contact myself, and I'll leave Kevin my email address, and I'll let you know after COVID when we resume our meetings. and we discuss issues just like we're talking about today. We try to focus on something that an unmet need of the Lexington-Fayette County community, and how we can come together to address that unmet need. So thank you for allowing me to be a part of it today.
Yeah, it's a great way to keep this conversation going beyond just COVID. Dr. Talbert, final words, your message that you would like to leave with our viewers.
And again, I want to reiterate what everybody else has been saying. It's been really an honor and a privilege, Kevin, with you as everyone, to have this opportunity to talk with you all. So I've learned a lot and I've listened a lot, and I really want to just kind of end with a quote. This was something that just struck me because I'm always reading. So it comes from the Institute of Healthcare Improvements, the IHI. But anyway, this quote is that if there is a silver lining in this pandemic, it may be the opportunities this unprecedented challenge has presented to us. And every decision, this action to prepare and respond more effectively to new realities facing us. But there's also an opportunity to build a system and structures. And Vivian, you would like this, and Andrea, all of you, that equity is a crucial component of what we do and how we move forward. And if healthcare moves to right past wrongs, perhaps other parts of society will follow. So to Devine's point, this is not all just about healthcare, because healthcare is a point of care and a point in time. It's not the entire system by which we live, pray, and play, right? So it's so much bigger than that. So I just challenge each of you, myself and my colleagues in healthcare, to have a new vision for this new normal, and to recognize that, and a trusted colleague also said this, that vision without an execution or without execution is a hallucination. So we don't need to be hallucinating about it, but we need to be serious about it and have a plan and execute that as well, because that's to, Pastor Moore's feedback, that's when we start seeing action. And this is beautiful because there've been a lot of great things that have come from that. And I would be remiss to also say the data, the numbers don't lie. So we have to continue to monitor those, report them. Their transparency is important, but follow up with action. So I really appreciate the opportunity to be here with all of you today.
All right, thank you for that, Dr. Talbert. As I wrap up, I want to ask our panelists, I'll be leaning up to stop the recording in a moment, but stick around for just a few minutes so we can chat afterwards. For those of you watching, thank you for spending a little more than an hour with us. Hopefully you've learned from this. If you've watched it, you have learned. That's as simple as that. I think all of us on here have learned something today. Share this with people. And I say that sincerely. That is get the message out. Let people know this conversation is going. A lot of our panelists from each time have come from watching this and sharing it and talking about it. And we want to know what else we need to discuss. Leave comments, reach out to us, become part of the Health Equity Network. Talk to people about the issues that are facing you and what we need to address in this. There are people in the mayor's office, and not from the mayor to Andrea to Laura Hatfield to other council members who have been an active part of this. Reach out to them, talk with them, talk. And the last thing I'm going to say to this is, we didn't bring this up today, but we have talked about it before. Mental health is a huge piece of this. Please check in on your friends, your neighbors, your loved ones. Check in on yourself. Take some time each day to clear your mind, to do something for you. And if you have an issue, talk to someone about it. You're not in this alone. You can talk to people about it. Check in, be friends, be neighbors. Thank you for watching, and we will be continuing this discussion very soon. Thanks a lot, Lexington.